Hello everyone. Now in this video I am going to tell you about a topic which is precocious puberty. So what is precocious puberty? That means whenever the puberty is appearing quite early. For example, its definition is like this. Whenever it is asked in the exam, just remember the definition that whenever the secondary sexual character in a female is occurring before the age of 8 years and the menarche is appearing before the age of 10 years. That means the first menstruation cycle in female occurring before the age of 10 years. So basically in this also, because it is puberty, so it is definitely related with the hypothalamus pituitary and ovarian axis disorders. So what we have to remember, like what is the generalized physiology? For example, in case of there are two types of we can say precocious puberty we can define. One is true and one is that is pseudo, or you can say false. So true or complete, we can also name it as complete precocious puberty. So in this there is abnormal hypothalamus pituitary ovarian axis activation in earlier ages. So these axes will be activated quite you can say it will start producing all the hormones which are needed in the normal growth of the secondary sexual characters quite early age in girls. So you can remember this by this. For example, our hypothalamus will be producing gonadotropin releasing hormone, pituitary will be, then it will activate our anterior pituitary to produce follicular stimulating hormone and luteinizing hormone. So basically all these hormones will be produced before the age of 8 or before the age of 10 years. That will lead to the growth of the secondary sexual characters. So this is the you can say early puberty, when puberty occurs quite early. This is known as precocious puberty, or you can say in case of true or complete precocious puberty. So in these cases the girl which is having this true or complete precocious puberty, there will be the growth will not be as normal as compared to other girls, because in this cases estrogen will be produced in quite high amount, and when estrogen is produced in quite high amount, it will lead to the long bone epiphyses to fuse. So long bone epiphyses will be fused in these cases, and the height will not reach to its maximum potential. So this is about true and complete precocious puberty. But if we see in case of pseudo or incomplete precocious puberty, in these cases this mainly occurs due to the result of the sex hormones. So sex hormones like you can say sex hormones are androgens, or you can say estrogens, progesterone. So the hypothalamus pituitary axis is normal in these cases, but there is in the ovarian axis, or you can say downward, it will be increasing the formation or increasing the secretion of these hormones that will be leading to the precocious puberty condition in these girls. So basically now what is the main etiology? So etiology, if we will look in these two you can say genre of the girls. So in case of true or complete precocious puberty, it can be, the main etiology will be idiopathic and it runs in the family. For example, mother will be having, then the girl will be having. So this can be the familial cases in case of true or complete precocious puberty. While in case also there is another etiology, that it is can be idiopathic without any particular cause also it can occur. And also there can be some kind of neoplasm which is producing gonadotropin releasing hormone, or which is producing prolactin, or which is producing luteinizing hormone or follicular stimulating hormone in quite high amount, and also some endocrine metabolic disorders. So these are all the etiological main factors which are which comes under true or complete precocious puberty. While in case of you can say pseudo or incomplete, they usually, the main etiology is mainly due to some you can say androgens secreting hormone tumors, or some you can say ovarian tumors which are producing more and more estrogen and progesterone. And also there can be adrenal hypoplasia in this case, and also adrenal hyperplasia can be there, which will produce more adrenal hormones. And also there can be hypothyroidism. So this is the general etiology that you have to remember between this true, complete and pseudo, or you can say incomplete type of precocious puberty. Now, what are the clinical features? So if we will look at the clinical features, first of all, it runs in the family. So whenever a girl will come to the doctor, we have to see if her mother also had the same problem or not. And also in these females, all the reproductive functions will be normal. So the reproductive functions like the reproduction and also even the pregnancy, they all are normal, because it's just the hormones are producing earlier, but they are not you can say abnormal until or unless there are some tumors or some neoplasia. So this will be normal. And one important feature will be that when these girls will reach to their limit of the puberty, and when the puberty stops in these girls, the normal height which they have to attain will be low as compared to which the normal girls will attain. So there will be height will be decreased. The main reason for the decrease in height, as I already told you, the estrogen will be formed in quite a high amount, and that will lead to the long bone epiphyses will be like fused, so that will lead to the growth sprout in these girls will be decreased. And also they have some sort of psychosexual and emotional development earlier ages. For example, 11-year or 12-year girl will be having the mature mindset of a 18 or 19-year girl. So the emotional and psychosexual development is also quite high in these girls. So now what are the investigations? Like, these are the clinical features that a doctor will see, or the patient that will tell about her history. But now what are the clinical examination that we can do, or investigations? They can be, we can do radiography. For example, we can do wrist radiography to check the bone age. So example, so the bone is completely developed or not. So in that cases we can check that the bone is completely developed. And we can also check the thyroid function, T2 T3 T4 functions can be checked, and thyroid stimulating hormone also, because if thyroid stimulating hormone is increased, it will lead to the further increase in the follicular stimulating hormone. Also we can do CAT and MRI scan of the skull, because there can be some sort of neoplasia or tumor may be present in the brain. Also we can do in these girls adrenal function test, for example, because there can be adrenal gland hyperplasia can be there, so which are producing more and more adrenal hormones. Also pelvic sonography we can do to find out any case of ovarian tumor or some other tumors in the genital tracts, which might be increasing the sexual hormones, example estrogen or progesterone, you can say growth. And also we can check the level of certain hormones like FSH, LH, estrogen, then they will be quite high in these cases. So these are the main investigation that you should do. And now what are the main treatments that you should do in case of precocious puberty girls? So first of all, on all these girls there will be we have to check maybe there can be cases of hypothyroidism or adrenal hyperplasia. Also these girls are quite matured according as respect to their age. So we have to first drug that we have to use here is depot medroxyprogesterone acetate. So that can decrease the menstruation cycle, you can say the cycle which is occurring normally, it can reduce its frequency. Depot medroxyprogesterone acetate. So this is the first drug that you have to give. Second, we can also give kyproterone acetate. Kyproterone acetate we can also prescribe to these girls. Also we can give GnRH analogs in these cases. And if there is any kind of tumor or any kind of neoplasia that is leading to the increase in the hormones of in such girls, we have to excise that tumor also by surgical methods. And side by side, while using these medication therapy, we must also give definitely calcium and vitamin D prescriptions to prevent drug because these drugs can lead to osteoporosis. So to prevent this osteoporosis, we must also give calcium and vitamin D in such girls. So this is everything that you have to remember related to the precocious puberty. Thank you.